Hello. As usual, this is take number 463. Been trying to get this recorded all day. Didn't want to do it in the middle of the night tonight because I gotta be in Boston by 7:30 tomorrow. So, anyways, here is the immune system. With the immune system, you're gonna see um, kind of a cross link between hematology, immune, and even cancer, um, and they all kind of just run together. So, the immune system has our lymph nodes, our white blood cells, our spleen, our thymus gland where our T cells go and mature. Our bone marrow is where the stem cells come from. Our tonsils and our adenoids, and our nose hairs. What they do is when we breathe in, they filter um, the toxins or the pathogens or whatever. Um, Coughing is actually part of the immune system because it gets foreign matter out from our lungs and we expel it in the air. Um, you guys, if I might talk a little bit of coronavirus with our immune system at points here, but if you think about it, all those things are what fights. If we're in contact with somebody, say with coronavirus, they cough or sneeze, and we breathe it in, our body's going to recognize it as foreign, and it's going to try and get rid of it. So that is why some people are more prone to different types of things because their immune system doesn't fight as hard as others, if that makes any sense. Um, Here's just a funny cartoon, out to lunch. Um, we don't want our immune system out to lunch. We want it functioning as good as it can possibly be at all times because we never know when we're going to run into something or our patients are going to run into something. Um, there's so many things that we actually do to boost our immune system that we don't even think about it. So getting enough hours of sleep at night is one thing. Um, eating balanced meals, eating breakfast, uh, maybe taking vitamins, or even avoiding others if they're sick, so that we don't get it, or there's not a chance that we get whatever they're sick with. So if somebody has the stomach flu, we don't just automatically, hey, I want to come over and hang out while you have the stomach flu. We tend to try and stay away just to kind of keep our immune systems working and fighting for us. So some of the things we're going to go over are autoimmune diseases, HIV, cancer, transplant issues, and then like chemo and radiation, so cancer treatments. Immunity. Definition of immunity is basically the ability to destroy pathogens or foreign material so that our bodies or our patients' bodies don't have further cases of certain diseases. If you think about it, immunity is the body's response to foreign microorganisms. um, Kind of talk about the immune system as like soldiers. I know it says in here army guys, but I call them little soldiers. So anyways, the normal immune function, our body recognizes self from non-self, so it'll recognize our cells as compared to um, other cells, viral cells, whatever. Um, it should be able to destroy these pathogens and other materials so that people are not getting sick, whether it's bacteria, virus, fungi, um, abnormal tissues, abnormal cells. Our immune system should be able to protect us from cancer. A lot of times that's how the cancer comes in. It's these cells are mutated and abnormal, and the immune system usually identifies them as normal, as abnormal, and attacks them and gets rid of them. Well, when the immune system isn't functioning properly, these abnormal cells are just going to continue to replicate, and cancer or a tumor is going to form. Normal function of the immune system, if somebody has a transplanted organ, it will recognize that organ as foreign because it's not from the body. So if we'll get more into it in a little bit, but Um, if the body is recognizing that organ is foreign, it's going to try and reject it or get rid of it. When the immune system cannot recognize self from non-self, it's what's called the autoimmune disorder. So it destroys self cells instead of destroying non-self cells. Some of the things we'll see, the allergies are a process of the immune function. Um, autoimmune disorders, like we talked about. So what should happen is like an antigen or pathogen um, has these markers on it, antigens, introduced to the body. The body recognizes or sees the antigen and forms an antibody for it, and it removes the antigen. So now the body makes memory of it. So if this sickness, or that's how we get our immunity up. Once it's sorry, my words are gone today. Once the body's exposed to this same antigen again, the body knows it, recognizes it as a danger, and gets rid of it right away. That's what should happen with the immune system. Allergies and autoimmune disorders are the exact opposite of that. In autoimmune disorders, they're attacking the self cells, so it's damaging to the body and body tissues, the joints, organs. We have a few diseases at the end, or illnesses that we'll talk about, that are autoimmune. Well, this is just a picture. Gives you kind of an idea. All right, so moving on. Antigens. These, like I said, are chemical markers that identify the cells and molecules. The person does have their own self-antigens, but these antigens can be recognized as foreign substances that are not part of the body, and the body will go and destroy them. These are things like bacteria, plant pollens, different proteins that trigger allergies like cat dander, well, you name it. My severe allergy is fish. And viruses. So that's why, like, the chicken pox. We used to have chicken pox parties when I was younger. If one of my friends had chicken pox, our parents would call each other and get together and be like, "Oh yeah, let's have a chicken pox party so that we can hurry up and get it done with, and then they won't have that again in their life." We didn't have the vaccine like we make our kids get now. We just had chickenpox parties because it would recognize the chickenpox as something that the body's already made antibodies to, this antigen on there, and then our body would fight it off. So. So lymphocytes are our fighters. They're our soldiers. There's 3 different types. There's the NK cells, the B cells, and the T cells. The NK cells is the natural killer cells. We find them in our blood, in the bone marrow, the lymph nodes, and the spleen. These are the ones that go out and destroy pathogens and tumors that the body does not recognize itself. So the name helps us remember what it is. They're the natural killer cells. B cells and T cells, they have different functions. The T cells are cell-mediated immunity, and B cells have humoral immunity. I think they're coming up a little bit further in depth, but generally the T cells are the ones that activate the B cells. So they both are made in the red bone marrow. The T cells, like I said earlier, they migrate and move to the thymus so that they can mature and grow. And then they move to the lymph nodes and the lymph nodules and the spleen to live out there to, once they're activated, be closer to the infection. B cells, um, like I said, they are made and they mature in the bone marrow, and then they go out to the lymphatic tissue until they're activated. Um, these T cells, when the count is low of T cells, this is what we think when we hear people talking about AIDS and their T cell count. Um, ugh, sorry, I'm trying to put my hair up. Yeah, I think that's pretty much everything. Um, Pam has some vocabulary out on this slide. Immunocompetence, basically this is the normal immune system response. Just means that our immune system is competent. HLA is a human leukocyte antigen. Hyperreactive is an autoimmune response where the body actually overdoes it. Some of the own tissues are recognized as foreign. Hypersensitive is basically a fancy term for an allergic reaction. An immunodeficiency is just the poor ability of the immune system to fight off anything. So, this picture just kind of shows the different types of T cells, like the killer T cells, which are, like I said, those are the direct frontline soldiers. The helper T cell stimulates the T and the B cells to be activated. The suppressor T cell is the one that says, okay, that's enough. You don't need to act anymore. The pathogen's no longer a threat. And the memory T cell is the one that remembers it for the next time the person is exposed. So, antibodies, also called immunoglobulins, Ig, or gamma globulins. Yeah, I can't say it. It sounds like I'm saying goblins. These are just the proteins that are produced when there's foreign antigens. Igs or gamma globulins do not destroy the threat, but they attach to the antigen and say, hey, this thing needs to be destroyed. So just remember, antibodies are the ones that tell the body, hey, this thing is foreign, get rid of it. So these are the different types. You guys will hear this in practice, and I know even in like infusion centers, they give IgG. I can't remember what other ones they commonly give, but so there's IgG, there's IgA, IgM, IgD, and IgE. IgG is the most prevalent of the antibodies. This one actually crosses the placenta. So when a mama's pregnant, their IgG antibodies cross the placenta, they're given to the baby and protects the baby for a little while until the baby can start making their own immune system. IgA, generally these hang out at the mucous membrane level. IgM, generally this is the one that's going to kick in first when a body is exposed to something the first time. IgD, there's not a whole lot understood about IgD. And which one am I missing? IgE is like the immediate allergic reaction. Types of immunity. There's passive and there's active. Passive means that it's transferred or given from another source. Created or produced by somebody else. These are temporary. People will need boosters, like Hep A. Naturally acquired passive immunity. This is when the um, immunity is passed from the mom to the baby, um, either through the placenta or breast milk. Generally, it's about 5 to 6 months and can be a little bit longer, especially if mom's breastfeeding. But this is what's given from mom to baby. Artificially acquired passive immunity. It's just preventing. It's preformed antibodies preventing the progression of a disease. So, like an exposure to hepatitis A. Moving on to active, where the body is producing their own antibodies. Um, Naturally acquired active immunity is where the person has the disease and the body builds the antibodies to fight against that disease if they're exposed again, like a chickenpox party. That gave all of us naturally acquired active immunity. Artificially acquired active immunity is when a vaccine stimulates the production of the antibodies and the memory cells. So the body thinks that it's had the disease, so it builds up all the fighters against it. It's just a concept map. All right. Cell-mediated immunity. Um, this is basically immunity for those pathogens that can actually survive inside the cell, like cancer cells or virus cells or cells that are infected by viruses. Um, the cytotoxic killer T cell. This is another one that like a natural killer cell. This tracks down and destroys the pathogens. Helper T. I think we went over this, but just a reminder. Helper T helps to activate the immune system. It helps. Suppressor Ts, like once the threat is over, somebody has to tell these guys to stop. Don't keep reacting if there's no threat. When these suppressor cells, if they're not able to get the body to stop reacting to a threat, this is where the autoimmune disorders come in. So, humoral immunity or antibody mediated immunity. This is what we talk about. This is what we see most. But the antigen is recognized, B cells are activated, and those B cells do their job. B cells produce the immunoglobulins or the gamma globulins that provides the antibodies. I think what all I want to say. This is the extracellular stuff, like in the humoral fluids. So like bacteria, viruses that go in the nose, it is humoral immunity that gets rid of it. So like the first time, the person might have humoral immunity within a week. The second time the body is exposed to the pathogen, it may happen in like a day or two. So because of the memory cells, they're going to react a lot faster. Yeah, this one is just a repeat of the slide. So basically, when the antibodies are formed, they bond to that antigen, make an antigen-antibody complex, which tells the macrophages and the neutrophils to destroy that. If they can't destroy that antigen-antibody reaction, it can actually go into different things. If I'm reading and thinking at the same time. if the body cannot destroy that complex, it's actually going to go into like an antigen antibody reaction, which is like glomerulonephritis because it's trying to filter it all out and it's clogging up. So the more they eat, the more they destroy. Sometimes that will increase the inflammation in this antigen antibody reaction and cause more of a response. So, just looking at my notes real quick. So first exposure will stimulate the production. I feel like I'm going over this and over this, but that's okay. The foreign antigen is going to enter the body, stimulate the antibody production to this antigen. It's a very slow process, so it can't prevent the disease in the first exposure, and that's why you have to be exposed to it in order to be immune to it, because it can't prevent it right away. By the time all the antibodies are formed, the disease has already kind of settled. What am I forgetting? Another antibody response is the anaphylactic shock. This is very serious. Their blood pressure drops, airway narrows because it's swollen, they get a rash. This is a huge, huge, huge reaction. So, example, my daughter actually just went into this. Oh, it's already been a year. But she has had dye in the past for a CT or an MRI, and it didn't really affect her. But when she got the dye last year, she went in to have an MRI of her brain. They gave it to her, and they gave it through an infiltrated IV. Actually, it was terrible. And she was gone for quite a while. And when she came back, she's blubbering, and I couldn't understand her. So I saw she was drooling all over herself because the lights were out because she had a headache. This is with her head injury, and she was literally, her face was swollen. She literally looked like she was one mass from the tip of her nose to her chin. Called her the Kardashian. But I went to wipe her mouth and I looked at the EMT that was there and I said, "How long has she been like this?" "Oh, I don't know." Whatever. So anyways, I yelled at him and told him I'd put her heart monitors back on and to go get the doctor. She was going into full anaphylactic shock. And they ended up pushing Benadryl and Solumedrol and I think one other thing through an infiltrated IV. It was terrible. But always be on lookout for anaphylactic shock with your patients because it is a medical emergency. And if meds can't get in soon enough, the person could actually die from it. Okay, so some of the things that we do that boost our immune system, probiotics, omega-rich foods, organic foods, vaccines, obviously. Vitamin D actually boosts our immunity. The more we're out in the sun, the better our immunity is. Exercise actually increases the IgAs. Social interaction, daycare, love. We're out and about with other people. I used to bring my kids when they were born. My mom used to work in a nursing home. And every time I had kids, I'd show up within, I don't know, a couple days. So I know, I think Maddie was three days old when I brought her over to the nursing home and started passing her around to all the residents. Just so that she could build up some of her immunity. The more she was around people, the more stuff she was exposed to, so the better her immunity was. And she actually has actually been my healthiest one. Sleep 7 to 9 hours a day or at night. Hand washing will boost our immunity. Everything they're telling you to do right now with coronavirus. Things that are harmful to our immune system is stress. I know I should not tell you that, but you guys are in nursing school. Lack of sleep, it's another thing in nursing school. Poor diet, drinking, drugs, smoking. Um, the more disease processes the body is exposed to can actually harm the immune system. There, we made it through that part. I gotta go grab a drink. I'm going to pause this, and I will be right back. Okay, I'm back. So, nursing care of patients with immune disorders. There are 4 different types. Type 1 is allergic reactions. Type 2 is like a hemolytic transfusion reaction. Type 3 is a serum sickness. And type 4 are things like a transplant reaction or latex allergy. So, type 1, hypersensitivity reactions. The best way to prevent these is to not be exposed to the allergen. So, like I said earlier, I'm allergic to fish. I stay the hell away from restaurants on Fridays. I don't go fishing. I used to take my kids, but I would have to like run away if they caught anything. So just try not to be exposed to the allergen. It can be a systemic reaction or a local reaction. Um, so with type 1, you have to have been previously exposed so that the body's sensitive to it, to the antigen. The IgEs are made attached to the mast cells that are roaming throughout the body. So when the second exposure comes, the IgEs trigger those mast cells to release their contents. Basically, mast cells release histamine. Um, so histamine will cause vasodilation, um, increase in mucus production, contraction of different smooth muscles. Um, yeah, you guys know what an allergy attack is. So allergic rhinitis is the most um, the most common that we see. Um, Seasonal allergies, hay fever, could it's just the body's response to like an environmental airborne. Um, when it has that antigen antibody reaction, like I talked about earlier, the cilia actually decrease their function, and the body produces more mucus, which causes the vasodilation and edema. So we're going to see sneezing, runny nose, drainage. If it is allergic rhinitis or it's an allergy attack, that drainage will be clear. Um, they can do different things. I don't know. It reminds me of a caterpillar where they put it on your arm. It's called a scratch test to introduce like very small amounts of different types of things to see if the body's allergic to it. Atopic dermatitis, also called eczema. This is an inflammatory skin response. We're going to see pruritus, edema, very dry skin. See this a lot in like children. Um, Generally, if we're going to be applying ointments and avoiding anything that irritates them. I know my niece has eczema pretty bad, and it's kind of on her butt, like right below her butt cheek. And she has to stay away from chlorinated pools. Any types of like bubble baths will trigger a very bad response. So yeah, and I think the only thing that works for her is hydrocortisone cream. We've tried everything. Still on hypersensitivity, going back into anaphylaxis. This is, like I said, very life-threatening. It happens immediately, and people need to recognize it right away. If anaphylaxis is not recognized right away, it can be deadly. Um, the histamine is released and causes a very fast vasodilation, um, and the swelling, like the swelling of the tongue, the swelling of the throat tissues, hives, They can even lose consciousness. So our biggest thing we need to think about with anaphylaxis is keeping that airway clear. We need to make sure there's IV access. Like the story I was telling you about my daughter, there really wasn't IV access, but we didn't have time to get another IV started. This was already her, I think, third IV that had blown that day. Yeah, it was her third IV. It was really crappy access, but it was kind of sort of access. Things that we're going to be giving them is epinephrine, because that'll help the body fight. Benadryl will help with the histamine. It'll decrease the histamine. And then we're going to give them a corticosteroid like the Solu-Medrol I talked about. So make sure you guys know how to treat anaphylaxis if you see it. A lot of places will actually have what's called an anaphylactic kit, and it'll have all these meds in it. Sometimes it's got IV stuff to start an IV. Yeah, so just make sure you guys are able to recognize it. Other things we might see in type 1 hypersensitivity are urticaria or hives. It's because the body's releasing histamine from the mast cells. Generally, it just kind of depends on what the cause is, how severe it is. We're going to be giving them an antihistamine like Benadryl, and if it's severe enough, we're going to give them a corticosteroid like prednisone or Solu-Medrol. Same thing for angioedema. This is just basically hives in the submucosal and the subcutaneous tissues. This is exactly what it looks like. This is a very mild case compared to what my daughter had with her anaphylaxis. But again, we're going to give the Benadryl or the antihistamine and a corticosteroid. Type 2, it's different from type 1 because type 1 needs a previous exposure. Type 2, just on first exposure, destroys cells or the substance that the antigen has attached itself to. So remember when something's introduced to the body forms that antigen, and the antibody labels it. It just eats and destroys the whole cell. The problem is when the antigen or the antibody is attached to a red blood cell, because that red blood cell is not able to be recognized as a self cell. So it's just destroying all of it, the antigen, the antibody, and the red blood cell. So an example is a hemolytic transfusion reaction. We kind of talked about this. Example is like an Rh factor. So when we give a person Rh positive blood and they're Rh negative, those red blood cells are going to be destroyed. Can actually cause stuff to build up in the blood vessels, cause necrosis and ischemia of the tissues and the organs that the blood is attached, or the circulating. I need to pause this for a minute here. Alright, I am back. Ooh, almost hit the wrong one. So moving on, hemolytic transfusion reactions occur when there's prior sensitization from a previous blood transfusion, or even a pregnancy, like the Rh negative and Rh positive. So symptoms we're going to see with the hemolytic transfusion reaction are the lower back pain, the flank pain. That's the big cardinal sign. Decreased blood pressure, increased temp and pulse. We're going to see them have chills, they're going to be wheezing, and they're going to be anxious. Diagnosis for a hemolytic transfusion reaction is a Coombs test. So remember, O blood are universal donors. It does not have any A or B antigens. They can only receive type O blood. AB are the universal recipients. They do not make A or B antibodies. So what needs to be done? If it's related to a pregnancy, a second or subsequent child, they're going to need that RhoGAM shot. If we're giving a blood transfusion, we need to stop the blood immediately. The nurse has to stay with the patient, which is why the phones on our nurses is so important. We didn't used to have those. We're going to take our vitals and monitor their symptoms. Obviously, we're going to return that blood bag and the tubing to the lab for testing to make sure it was the right type of blood. Call the doctor, and generally we're going to be giving Tylenol and Benadryl. What do we want to prevent? Basically, we want to prevent kidney failure because all those particles of the cells, the red blood cells, are going to get caught up in the kidneys. So we're going to give them fluids, and try and flush those kidneys and get all of that junk out. Hypersensitivity reaction type 3 is called serum sickness. So type 1, remember, is a previous exposure, like an allergy attack. Type 2 is cellular destruction, like hemolytic transfusion reaction. Type 3 is another hypersensitivity reaction, where immune complexes are formed by the antigen and antibodies from an initial exposure and following exposures. Localized, the reaction is localized, and it happens over hours. So again, these antigen antibody complexes form and then lodge in the blood vessels. This will cause tissue damage, necrosis, because the tissues and the organs are not going to be getting blood flow because they're clogging up the vascular system. This is what's seen when people are given penicillin or sulfonamide antibiotics. Generally, it'll happen a week and a half after exposure, and the first symptoms are going to be urticaria and angioedema. This is why it's so important to know your patient's allergies. And type 4 is contact dermatitis. Generally, this takes about 48 hours or 2 days, sometimes even more. But it's a cell-mediated response. It's not antibodies. Things like poison ivy, poison oak, or latex. Those are the most common causes of contact dermatitis. We're going to see the rashes. They're going to be reddened. They're going to be itchy, peely. We basically need to control the symptoms and avoid anything that we know the patient is allergic to. Another type 4 is a transplant rejection. So anytime a person has a transplanted organ or tissue, the body's going to recognize that as foreign. So what do we need to do? We need to make sure that we are suppressing their immune system so their immune system isn't attacking that new kidney. If we can't suppress their immune system enough, they will basically destroy their brand new kidney. Signs and symptoms, it just depends on what organ or tissue is affected. Like if it's a kidney, then we're going to see kidney failure. If we can get them treated, they don't always lose that organ. If we're able to suppress their immune system enough, they won't lose their organ. But with suppressing their immune system comes a whole gamut of other issues, especially the fact that if their immune system isn't working up to par, then they're at a huge risk for an infection. Imuron is a med that we use that is the immunosuppressant. Like I said, it just calms down their immune system so it's not attacking that brand new organ. So if we know that their immune system isn't so great because we've now basically chilled it out and said don't respond to anything, we need to make sure that they are not doing anything that could cause them to get an infection. Um, Generally, with our transplant people, the biggest issue is infection because they can actually go septic pretty easy um, because their immune system is suppressed. Um, Educating our patients, we need to make sure that they know that after um, they get their new organ, they can get infection, they can get septic, they can die. But if they don't take their immunosuppressant, their body may reject that organ. So it's kind of a double-edged sword that needs to be balanced. So things that we need to educate them on are signs and symptoms of infection, signs and symptoms of rejection. They need to watch their temperatures. They need to take their steroids. They need to be very compliant with their medications. They need to avoid public places. Anything that you can think of that will keep them from getting an infection. All right, so autoimmune disorders. So autoimmune autoimmunity is when the body's immune system does not recognize itself and starts fighting against itself. So it sees self cells and attacks them as if they were non-self cells. It can happen in cells, tissues, or organs. Some people think that a cause of autoimmune disorders is that maybe microorganisms like bacteria or viruses or drugs may actually confuse the immune system, so then they think that their non-self or their self cells are non-self cells. So one type of autoimmune disorder is the systemic lupus erythematosus. I have a hard time saying that one too. Easier to be called lupus for short. If it affects the kidneys, it can be fatal. Symptoms are very widespread. They might have alopecia, they might have polyarthritis, they might actually have bone necrosis from lack of oxygen. A fever is generally the first sign of a flare-up. You might see fatigue, anorexia, weight loss. But the key symptom or cardinal symptom of lupus is this butterfly rash across the face. You can see it really good in these pictures. I know one's looks like an animated, no, maybe not. No, yeah. Kind of an animated picture and one's a real picture, but that's exactly what it looks like. Lupus forms those immune complexes and then those complexes cause inflammation, damage, destruction. It's a pretty terrible disease. I had a patient once who had lupus, and he had been out um, on the boat the day before in the sun because that's a huge trigger. And he came in, his oxygen levels were low. He was in a lot of pain. Yeah, it was terrible. Fibromyalgia, you guys may have heard of this. It used to be termed a mental health illness, but now they're finally recognizing it as an actual physical disorder. It is actually a disorder in which pain responses are affected. So people with fibromyalgia, the way that their brain processes these pain signals is a different than somebody without fibromyalgia. It actually amplifies their pain. They have widespread pain, they have fatigue, sleep, memory, and mood issues. So signs and symptoms of fibromyalgia are pain, stiffness. They actually have trigger points where they're tender um, and can actually, when those trigger points are pressed, can actually elicit some of the symptoms. They're going to be tired, they're not going to sleep, might have sensitivity to lights and smells. A common symptom of fibromyalgia is actually IBS, irritable bowel syndrome. They might have visual problems, heart problems. Yeah, it's a pretty widespread illness. It's pretty terrible. People that have fibromyalgia are pretty miserable. Um, so nursing care, like I said, it used to be a mental health um, disorder, but it is now recognized as a physical disorder. So they've spent so much time that people not believing them because there's not a physical aspect that says what's going on. So if they go in for back pain and there's no like herniated disc, then it's kind of all in their head and it's a psychosomatic. So the best thing we can do is believe them. They're going to be on meds like Cymbalta and Lyrica. Cymbalta is actually an antidepressant, but it helps with the pain. And then teaching them their trigger points and letting them know that these are places that if they're stimulated, their pain could get worse. These are just a list of some other autoimmune disorders. There's rheumatoid arthritis, inflammatory bowel disease, multiple sclerosis, myasthenia gravis. I don't know how much type diabetes is. I've never heard that, but Guillain-Barré syndrome, psoriasis, and there's also a psoriatic arthritis, kind of like rheumatoid, but it's with the psoriasis. There's Graves' disease, Hashimoto's thyroiditis, and vasculitis. We've gone over a lot of those, and we'll go over some of them in other chapters as well. Moving on to HIV and AIDS. So, human immunodeficiency virus, HIV, is an asymptomatic infection. Just because somebody has HIV does not mean that they will necessarily develop AIDS in their lifetime. So, AIDS is the acquired immunodeficiency syndrome. This is the final phase of the infection. And like I said, not everybody who has HIV will develop AIDS in their lifetime. HIV, AIDS was once considered terminal. Once you're diagnosed with HIV, it's a terminal illness. Now it's considered more of a manageable chronic illness. Just some statistics. In 2018, there were 1.7 million individuals worldwide that got a new diagnosis of HIV. In 2018, also, approximately 770,000 people actually died from AIDS-related illnesses. So it's getting better. It is actually decreasing. So basically the pathophysiology is it's a retrovirus that contains this RNA genome and a reverse transcriptase enzyme that actually converts the RNA genome to DNA. It infects the helper T cells, because remember the helper T cells are the ones that go and help with the infections. It puts these CD4 cell surface receptors on it. AIDS, HIV is a progressive impairment of the body's immune system. So it doesn't just start and you have it. It just progressively gets worse. Sometimes it can take up to 8 to 10 years to actually start showing symptoms. And that's why there's an issue with it being transferred, because people have it and don't realize they have it yet and are passing it on to other people. Transmission of HIV, it is not spread casually. You can only get HIV by coming into direct contact with certain body fluids. And I said certain body fluids. Fluids like blood, semen, and preseminal fluid, rectal fluids, vaginal fluids, breast milk. For the person to get HIV, the fluids must have to get into their bloodstream. through a mucous membrane, like the rectum, the vagina, the mouth, or the tip of the penis, open cuts, sores, or injection. That's our next slide here. HIV is not spread by air or water. Insects, like if a mosquito bites somebody with AIDS and then they come bite somebody without AIDS, that person is not going to get AIDS or HIV. If there's no blood mixed with the saliva, tears, or sweat, it does not transmit HIV. Shaking hands, hugging, toilet, dishes, sharing dishes, closed mouth or like social kissing, like on the cheek, cannot get HIV transmission. Drinking fountains, sexual activities that don't involve exchanging of body fluid, and it cannot be passed through healthy, unbroken skin. So I had a patient that I took care of in the hospital who was HIV positive. I saw him a couple weeks later at the hospital when I had my kids with, and um, I usually don't like go up to somebody that I'm taking care of and say hi, but this gentleman approached me and said hi to me, and I introduced my kids to him, and I said, okay, go introduce, or I told them to introduce themselves to him, and I've taught my kids to shake hands. So they went up and said, hi, I'm Maddie, shook his hand. Hi, I'm Bailey, shook his hand. He literally started crying, and he asked if he could talk to me away from the girls, and he said, I can't believe you know my history, my medical history, and you didn't think twice about having your daughter shake hands with me. And I was like, well, why should it matter? And he's like, well, because you know my HIV status. And I said, yeah, but they can't get it. I said they could have given you a hug for all I care. And he literally cried right there. It was very moving, and I think about it quite a bit actually. All right, so stage 1 of an acute HIV infection generally happens within two to 4 weeks. After they get infected, sometimes they have a flu symptoms that might last a few days to a few weeks. Best thing to do if your patient thinks that you are exposed, tell them to go, turn it down, honey. Just get checked. They can do the Western blot test or the ELISA test. Stage 2 is basically a clinical latency or chronic HIV infection. They might not really feel sick. It's going to last a long time, up to like 20 years-ish. So their focus is to try and keep their immune system working well, keep it healthy, and keep their viral load undetectable. So the doctors will monitor their viral load pretty frequently just to make sure that it's not rising. They'll also monitor the CD4, which is basically the count of their T cells, because once that CD4 is less than 200, then that's when it develops into AIDS. So AIDS is a compromised immune system. The biggest cause of death related to AIDS is these opportunistic infections. The herpes simplex, the salmonella, the candidiasis, or the toxoplasmosis. Diseases that are directly related to AIDS are the Kaposi sarcoma and the cystis carinii. And it's basically a cancer and a pneumonia that only people with AIDS can get because their CD4 count is less than 200. So generally people don't die from AIDS. They die from an opportunistic infection or the one of the diseases. So another symptom, because I can't stress enough with the immune system, we need to watch their temperature, watch their fever, make sure that they're not having a raging infection starting. So treatments are antivirals. There's obviously no cure for AIDS, but if they stick to their antiretroviral therapy, it can slow the progression, prevent those opportunistic infections, and prolong their life. This is just a picture of Biktarvy. It's just one of the meds that they're taking. There's AZT out there that was common when I was caring for people with AIDS. Now there's also a PrEP and a PEP. PrEP is a pre-exposure prophylactic medication that people take on a daily basis if they're exposed to someone with AIDS. Maybe their significant other has AIDS. They'll take this PrEP just to try and prevent the spread of it. And then there's also a PEP, which is a post-exposure, where they can take if they feel like they have been exposed. They take this for, I think it's 5 days, but I couldn't remember off the top of my head. But we are moving. Hopefully someday there will be a cure for AIDS. So CD4 counts, we kind of went over this. When it's lower than 200, that's when these people will have progressed from HIV to AIDS. Generally, that CD4 count is anywhere from 500 to 1600. So you can see where if it drops drastically, that's why the AIDS. Viral load test is also another thing we watch just to see how much of these HIV particles are in their blood. Community-based care of people with HIV or AIDS, teaching for the patient and their family. We need to make sure that they understand how to do proper cleaning and disinfecting with bleach, because it's important to kill those germs that could cause those opportunistic infections. Because their counts are so low, they don't have enough to fight off the normal bugs. Need to teach them about sharp disposal, when to glove their meds, because I know some people set like alarms on their cell phones to remind them to take their meds. We need to teach them about mouth care, their nutrition, teach them how to inform their partners, because just because they've been diagnosed with HIV or AIDS does not mean their life stops. It used to be, like I said, a terminal illness and life was just done. But now there's so many things like the PrEP and the PEP, and people just look at it a lot differently. And we need to teach them signs and symptoms to report. Anytime that they have a signs or symptoms of infection, it needs to be reported to their doctor ASAP, so that they can be treated for it as soon as possible. Cancer. Moving on. We're actually flying through this. We've only got like 8 slides left. So when cells grow and divide and they're abnormal and they'll continue to grow, but let me try and rephrase that. So when there is a cell and it grows abnormally, these cancer cells actually multiply rapidly, a lot faster than regular cells, and they continue to duplicate that abnormal cell. And once they get enough of them, that's what forms the tumor. There's many risk factors. I don't really want to go through it. But the body cannot destroy these cancer cells because they're not sure how to destroy them. Some cancer cells are benign, some are malignant, which means they are cancerous. And then there's the metastasis, where they're growing so fast that they're invading other parts of the body. All right. So different types of cancers. Cancer of the epithelial tissue are called carcinomas. Also in the GI system in the lungs. Can you stop? Cancer of the connective tissues are called sarcomas. This is that fat sheath that covers the nerves, cartilage, muscle, and bone. So when that connective tissue is invaded with cancer, that's called a sarcoma. Cancer of the white blood cells. My daughter's so loud. Cancer of the white blood cells is called leukemia. We went over that last week. Cancer of the lymphatic system are called lymphomas. We went over that. And cancer of the skin is called a melanoma. Um, so warning signs of cancer. If you use this CAUTION acronym, it really kind of helps you remember all the symptoms. So a C can be a change in bowel or bladder habits. A is a sore that doesn't heal. I've seen this several times, especially with melanomas. They get a sore on their arm or on their skin somewhere, and no matter what you do, you can't heal it. U is unusual bleeding or discharge from any body surface. T is a thickening or a lump, like in the breast or somewhere else. I know when my dad had cancer, he was having terrible, terrible pain, and I would like massage his arms because it actually went everywhere. But you could literally feel the lumps all over his arms. It was terrible. Um, I is for indigestion or difficulty swallowing, especially if the tumor is uh, in, in the um, in the throat. O is obvious change in a wart or mole. And N is a nagging cough or hoarseness. So these are all just warning signs. Say if you have any of these, please get checked out. So treatments for cancer, there's different types of surgery. There's a curative, there's a palliative, um, there's a reconstructive. So if someone had a mastectomy or a double mastectomy where they're doing reconstruction of the breast, a biopsy, that's used to diagnose the cancer. They'll go in, take a tissue sample, check it for cancer. Amputation, maybe there's cancer in the bone of the lower leg. They might just amputate above the knee or below the knee, just depending on where the cancer is. An exploratory surgery, they're going to go in and look at it. DNC, dilation curettage, especially if it's in the lady parts, and then a debridement. So there's different ways to treat cancer. Not all of them will cure cancer, but it may help with some of the symptoms. So immunotherapy, basically it's the body's own immune system to prevent, control, and get rid of the cancer. So basically the immune system can recognize and attack those cancer cells. Some cells they're called boost immune cells, will help them eliminate the cancer. And basically the body's just getting help with the immune response. Radiation is used to control the growth. It can be curative. It can be palliative in nature as well. It just kind of depends on how far the cancer has gone, what stage it's in. There are different safety issues with it. I don't really want to get into that. I don't want to throw all this stuff at you. Side effects. They're going to see skin problems. That is the most common issue with radiation. Their skin might be dry, blistering, peeling. We want to try and keep them out of the sun because their skin is already so sensitive. They might have dry mouths, so we want to teach them to use like sugar-free hard candies. They might have tooth decay. You might see lymphedema. They might be short of breath. They might have difficulty swallowing. They might develop pneumonitis or radiation fibrosis in their lungs. Nausea, vomiting, diarrhea. So there's a whole list of side effects with radiation. So we just need to teach our patients how to deal with some of those things. I had a patient once who had cancer in the roof of his mouth, and he did have surgery and have part of his roof of his mouth removed, but then he had to go in for radiation treatment, and it actually burned like the back of his throat so bad that he couldn't eat. So basically, I was trying to teach him to chew on ice chips whenever possible. Chemotherapy. Chemotherapy is cytotoxic, which means it doesn't care what cells it destroys. It just destroys cells. It's not going to pick what's good and what's bad. Symptoms of or side effects of chemo. There's several. Common ones are mucositis, fatigue. There's hair loss. They might bruise or bleed easy. They're a huge risk for infection. They're going to be neutropenic 9 times out of 10, or even anemic. You're going to see nausea, vomiting, anorexia. They might actually develop peripheral neuropathy. People report chemo brain, and I know even my friends that have survived cancer still report chemo brain, and their cancer was like 10 years ago. Every time they forget something, they're like, oh, that damn chemo brain. You might see mood changes and obviously fertility problems. So, chemo's a nasty thing. Sometimes the benefits don't outweigh the risks, or is that what I want to say? The benefits don't outweigh the risks. The side effects are so terrible from chemo that some people wish they never would have started them. My dad did 1 chemotherapy treatment and I think 5 radiation, and that 1 chemotherapy knocked his white count down to like 0.023. Caused blood clots. Nausea and vomiting were so terrible. He made it through 1, ended up in the hospital with all of these other things caused by the chemo, and just said, that's it, I'm done, and literally called hospice himself. So just be there for your patients. Let them know that they don't have to do chemo if it's not their thing. All right, lymph system. Did we just go over this? I can't remember if it was in this class. Yeah, it had to have been this class. Lymph system, basically, we went over this, but we'll review it now. It's part of the circulatory system, part of the immune system. There's tissues, organs. Basically, what it does is it carries this lymph fluid towards the heart. It picks up all the junk and expels it. The organs that we see in the lymph system are the bone marrow, the thymus, the lymph nodes, the spleen, the tonsils, and the lymphatic tissue. That lymph has those white blood cells that fight and circulates them throughout the body, so that when there's an issue, the white blood cells are right there to attack. So there's the lymphomas related to the lymph system. There's Hodgkin's and there's non-Hodgkin's lymphoma. So Hodgkin's is cancer of the lymph system. Obviously, so is non-Hodgkin's. But the difference between Hodgkin's and non-Hodgkin's is that in Hodgkin's, the person is positive for these things called Reed-Sternberg cells. And that's how they diagnose it. Hodgkin's is more treatable than non-Hodgkin's because it's caught earlier. The biggest thing with Hodgkin's is when these people are drinking alcohol. Once that alcohol hits their lymph nodes, it has a hard time filtering it, so it causes severe pain. And it's only a sip. It doesn't even have to be like a whole drink. It's just once that alcohol hits the lymph nodes, it's very, very painful. Non-Hodgkin's lymphoma is more common, but it's all the other type of lymphomas. Any type of lymphoma that does not have Reed-Sternberg cells is considered a non-Hodgkin's lymphoma. This one is more likely to mets to other areas, which gives it a worse prognosis than Hodgkin's lymphoma. Basically, there's tumors that develop from the lymphocytes. Symptoms of both of these, we're going to see abdominal pain, swelling, chest pain, coughing, shortness of breath, swollen lymph nodes because they're working so hard, they're growing. They're going to be fatigued. We're going to see fevers, and we're going to see night sweats and weight loss. So both of them. But the different symptoms for Hodgkin's is when they're drinking that alcohol, and the difference between them for diagnostics is there's Reed-Sternberg cells. All right, now that is it. We actually made it through, and I'm actually going to get a phone call from one of the other instructors in 1 minute. So you guys have a great night, and let me know if you have any other questions, okay? All right, I'll get this posted as soon as I can.